Well, hello. I'm Dr. Cliff Robertson. I wanted to send out a quick update on the Blue Cross negotiations and, in fact, use this video to address a letter that was recently mailed out by Blue Cross to patients all across the state. The reason I wanted to specifically address the letter is because there are misstatements of facts that I think should be corrected for the record. First of all, the contract is between Uninet, which is a Nebraska-based organization. It's physicians and advanced practice clinicians and hospitals in Nebraska and Iowa that are part of Uninet, and that is the entity that is contracted with Blue Cross Blue Shield. Second of all, there have been no delays on the Uninet side. In fact, it's becoming increasingly clear that Blue Cross Blue Shield is intending to push these negotiations to the wire, or even maybe they're intending to push Uninet out of network with the goal of achieving maximum pain and chaos for patients, which they believe will help them leverage their position. Another point that's been stated in the letter that's factually incorrect is that Blue Cross Blue Shield has been working for years with Allegiant Creighton Health to modify the costs. Well, that's also not true. In fact, what Blue Cross fails to acknowledge or fails to mention in their letter is that the contract Blue Cross just terminated and set a 90-day timeline to try to renegotiate was a contract that we had spent 10 months, that Uninet had spent 10 months negotiating with Blue Cross Blue Shield, which resulted in a mutually agreeable contract, which both parties signed on February 13th of this year, of 2014. So let me say that again. So Blue Cross was perfectly content with the agreement that had been negotiated between Uninet and Blue Cross, and they signed that agreement in February of 2014. They then turned around 2 months later and chose to terminate that very new contract with some other purpose in mind. We actually don't believe it was about hospital rates, although they've used that as their public case, because they agreed to those hospital rates that they're now complaining about and signed that agreement in February. We actually believe this is about the physician rates, which they've been vocal in their complaints about all along. Uninet offered to freeze physician rates. Uninet offered to extend the existing contract so that a new agreement could be worked out, but Blue Cross Blue Shield chose to terminate the agreement. And they chose to do that specifically to put patients in the middle of a negotiation that should be handled behind closed doors and at a negotiation table. A third point that's in the letter that needs to be addressed is that Blue Cross has said that they are willing to partner, and they give an example of a value-based model that they've apparently rolled out with a physician organization called SERPA. Well, if you actually look at the model that Blue Cross Blue Shield has rolled out, there's a couple of things that are important. One, I don't think it has any guarantee around quality, first of all. Second of all, I'm not even sure the way they've structured this model, it will actually lower costs. I actually believe that it'll increase costs for employers who will be footing the bill out of the chute in this agreement with maybe a hope that there would be some savings down the line. It's a model that looks very similar to things I saw in the 90s, which is more of an insurance company trying to pit physicians against other physicians in hospitals. That didn't work in the 90s. It won't work now. And everyone around the country understands that it's integrated networks. It's physicians of all specialties working together with hospitals to really improve not only the quality of the care, but also deliver care in a much more cost-effective way. And lastly, I think a point that I should specifically call out. The last point of their letter is that they believe that all providers should be paid the same. So what they're essentially saying is that as a health insurance company, they believe they know better than patients, that they believe they know what quality is better than patients know, and that they're saying is that long-term established physician-patient relationships have no value. That is exactly what they're saying in this letter, and you can look at their own words. We, those of us that are a part of Uninet, adamantly disagree with that approach. We think that payment should be aligned with value, which is quality and cost. And that's the crux of the issue. That is why we are having this dispute with Blue Cross Blue Shield, because they are unwilling to leave an old, out-of-date business model, a fee-for-service model, and move into a value-based world, which our other health plan partners, Aetna and United, have already done. We have models already in place with both Aetna and United that are documenting savings, and we're working very closely with those other payers who truly want a provider, who want to partner with provider systems to expand the product offerings we will have jointly across the state. We'd love to do the same thing for Blue Cross Blue Shield members. We are at the table. We are willing to put our money where our mouth is in terms of coming to an agreement that will actually lower costs for patients, but it requires a health plan that's willing to be a partner instead of wanting to be in control. So I'm sorry I don't have better news for you at this moment. We are committed to try to make this work, but I will be honest and say that it is beginning to feel like Blue Cross is fully intending to push us out of network and to throw patients in the middle of something that never needed to occur. So thanks for listening. We'll talk to you again in a week or two.